The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there.
Welcome to Unravelling. This is a podcast that sees the world through the lens of mental health. I'm Mary Wilson, a journalist.
And I'm Kurt White, a social worker and psychotherapist.
So it is January, Kurt, and this is a month when many people recognize Dry January, a time to stop drinking alcohol. Maybe people think they indulged a little bit too much over the holidays or the New Year, or it's just part of their New Year resolution, trying to be healthier. A lot of us know that drinking, of course, isn't great for us, right?
Yeah, that's what they say. And I think, of course, we see it sometimes around the extremes of it, right? We think, oh, gosh, this person maybe has had a problem or has a problem or should have a hard look or something like that. But alcohol actually is one of those things that a lot of people have a relationship to at some level, maybe even those that don't necessarily even see themselves as drinkers, actually.
Right, and maybe they see themselves as casual drinkers, or they're just doing it to celebrate, or get to the end of a long work week and unwind, right?
Absolutely. Yeah, absolutely. And I think the public health messaging around that for a long time has really been just sort of keep it under a certain level, and then probably if that's true, you're okay. But I've been kind of keeping an eye on some statistics over the last, decade or so that have been coming out, and I've been a little bit troubled about what I've been seeing. It seems to be painting kind of a more negative picture than I wish it was.
Yeah, we have some alarming national headlines that have really caught our eye, including that alcohol deaths have more than doubled in 2 decades. According to a study, Americans dying of illnesses related to alcohol at roughly twice the rate seen in 1999.
Yes, and some other studies have shown that, it seems like the COVID pandemic, we're really just getting the data on that, made some trends that were maybe already happening even worse. People continued to drink during the pandemic, didn't stop, maybe drank even more, and that there are some links being better understood about the things like certain health problems like cancers and alcohol. That maybe I don't know that a lot of people necessarily associate those two things together in that way as like a risk for themselves at moderate levels.
Seems to be a lack of education about this.
Yeah, and I think there's just been a lack of information. I think it's really taken time to have the picture really be painted. I think, a public health crisis doesn't emerge overnight out of nowhere, right? It's actually something that emerges slowly over time, usually, when there is a sort of maybe a change in social patterns or social behavior that leads to different outcomes. And it takes years for the data to kind of accumulate. And I actually think it's not an exaggeration to say that with respect to alcohol, we are literally already in the middle of a public health crisis that just isn't fully recognized yet.
Wow. So our next 2 episodes will cover alcohol and our relation to it, beginning with an interview with Dr. Geoff Kane.
Yes, Dr. Kane is an old friend and colleague of mine, works here with me at the Brattleboro Retreat, although he's partially retired. He's been in the field over 50 years, has written books about alcohol and substances, has a person-centered approach, which we'll hear about. And I think just a lot of wisdom to offer us about this issue. And we really have an interesting dialogue about it.
Yes, let's take a listen.
Welcome to Unravelling, Dr. Kane.
Thank you, Kurt.
Absolutely. It's good. I thought it would be good to bring the public into this 19-year conversation we've been having about alcohol, and so look forward to talking to you today about it. I think my hope for the day would be that we could have the kind of conversation about alcohol that people might listen to, maybe people who might skip this one or shut it off maybe because there's something sensitive about the subject, or they sort of know the story already. They know what people are going to say. Maybe it's not good for you. They might get that message. It's not good for you. Why do you think alcohol is so hard to talk about?
Maybe because people have so many different views about it and promote rules about it. And I think today it's very much up to the individual what they do about it, what they think about it. And I think two things we should be emphasizing now at this stage of our history is that it is up to you, the individual, and what you don't know might hurt you.
I like that. It's really true. And I think maybe as professionals, we haven't always done the best job of giving people accurate information to make those choices. At least it seems to me. Maybe we've oversold the extremes.
For sure. And professionals trying to do the right thing haven't had the best guidance or information to work with in terms of what their input has been. The old school way of thinking was an emphasis on addiction to alcohol, alcoholism, which is a word that's kind of out of fashion these days. And the people I met in treatment centers clearly had a gap between their intention and their behavior, a disconnect, so that they couldn't reliably do what they wanted to do, which was to lighten up or stop. And today, from a population standpoint, a public health standpoint, we're more aware of a lot of people who are not at that extreme. I sometimes speak of a classic genre of addiction and people who are in the deep end of the pool with their substance use disorder. And they need a lot of help, and there are mechanisms for providing that. But there are a lot of people who are not in the deep end of the pool. They're using modestly. They may not be worried about how much they're using. And when we look at statistics, there are 178,000 deaths a year attributed to alcohol, which is a higher number than we used to have. Whether the statistics are more accurate or there's an increase in problems, we don't know. But more than the individuals with that control problem and diagnosable addiction, there are people who are overindulging, binge drinking on occasion, and more of those people die and have problems. There's more cost to society from that group than the people who are in the deep end of the pool.
Yeah, and that's something I've been noticing for a number of years. I think I was struck a number of years ago when I was teaching a course, one that you also taught at one point in time before I did, the psychopharmacology of substance use at Antioch in their Master's in Counseling program, that the World Health Organization, for example, considers and has long considered alcohol to be the most dangerous drug in the world. And I think I was surprised by that at that time. I'm not so surprised anymore, but what about you?
Well, I think tobacco's up there also, perhaps with more deaths than alcohol-related. Yet I think people underestimate the risk of alcohol, and even the guidance that governmental agencies and all provide overestimates of what's a reasonable amount to consume.
Yeah. You know, I've observed sometimes that people aren't necessarily that tuned into absolutes about those things, that actually when people judge their own behavior, they're judging it in comparison to those around them, to the social norms around alcohol, or to the imagined person that actually would have a problem, right? Which is someone usually off in the distance a little bit further than wherever someone is, right?
In our discussions, you've given some emphasis to the recent guidelines in Canada, and they're, I would say, much more appropriate and, dare I say, enlightened than what we've been going by in this country. There's an emphasis on autonomy and respect for the individual and permission for them to do what they like, with the hope that they'll do it with enough information so they know what they're getting themselves into.
Yeah. And you brought up the idea of more than is reasonable. What is reasonable drinking?
I have to go to a person-centered answer. What's reasonable drinking is what's reasonable for that individual. And in the spirit of harm reduction at a community level, there are individuals who are drinking way more than anyone would ever consider healthy, including themselves. Yet they're not prepared to do anything about that. And to question it or urge them to do something differently just brings out indignation and more of the same. when people are consuming an amount that is within their risk tolerance. I think autonomy and risk tolerance go hand in hand. And if someone knows that there are risks and they do it anyway, if their intention is not to do it, then we need to talk about addiction. But if their intention is to do it anyway and they'll pay the price, that may be reasonable for them. And there are lots of people who don't drink at all, and that's reasonable for them.
Well, and I think, for me, part of why I wanted to talk to you today is because I've been loosely following data that's been coming out over the last 15 years or so, and longer, really, but it's been accumulating, that suggests that there is a need for the revision in the way that we think about safe and unsafe drinking, including especially among people who are not your typical so-called alcoholic or problem drinker, people who may be experiencing significant negative effects of their substances, the substance of alcohol in particular, in their lives, without really understanding what the actual data on risks is. I wonder if you could speak to some of those emerging data points that I know you've been following too.
Challenging to know where to start, but I'll start with, you said safe and unsafe. And research would show that there probably is no, quote, safe, unquote, use of alcohol. And one of the things I like about the Canadian guidelines is that if you're interested in a no-risk approach, 0 drinks per week may be the number for you. And 1 or 2 is probably not a sky-high risk. To get to this setting where we are, I cross a roadway that's sometimes kind of busy, and some of the traffic includes logging trucks. I do not want to be hit by a logging truck, yet I assume that risk every time I cross that street, and I'll probably look both ways twice and take my precautions, and I'm not going to avoid crossing the street, but I'm going to do it with my eyes open. And when people understand that even a little bit of alcohol in pregnancy, for example, can have unfortunate effects on a fetus, any alcohol in a teenager can have unfortunate effects on the development of the brain and on future risk of serious problems with alcohol. The risks are there, and I encourage people to know what they are and decide what their risk tolerance is. And I think that's the movement that you're describing. There's a movement away from cut and dried thoughts about what people ought or not to do, where now everything is pushing more towards an individualized sense of responsibility, and the consequences fall to the individual.
And it seems to me that there's been a number of different, often when we study things in medicine, for example, we study it condition by condition, right? What is doing this or not doing this cause in terms of like the odds ratio, the likelihood, overall likelihood that you're going to develop some unwanted problem, something you really don't want for yourself later in life, maybe soon or maybe well on down the road, right? And I think people have a general understanding that drinking a lot may be bad for you in maybe a number of different ways. But I think there was kind of an assumption that it was kind of on one side of a threshold, low risk, high risk. The current American guidelines, I think, reinforce that. They said, well, here's low risk drinking, here's high risk drinking. But actually the numbers you can sort of stay on the side of low risk and actually still be drinking quite a lot, can't you?
Yeah, and perhaps having a higher risk of consequences than you might choose if you knew what those consequences were.
Right. And it has seemed to me that some of that there's been a kind of convergence of some of those studies that suggest that the relationship is not like a threshold relationship, that on this side of it you're okay, and on this side of it you're in big trouble. It's much more a kind of a graduated linear relationship, that the more you drink, the more likely this problem is to happen.
Sure. And even the diagnostic guidelines have moved from a two-category characterization of issues with alcohol to a spectrum of issues. And I would say, and that hasn't gone far enough to recognize the continuum that you're talking about. And it is more an individual matter. And my message to individuals, or reality's message to me, and I pass along to individuals, is to be paying attention to your behavior with alcohol and how it fits with where you want to be. And it's sort of longevity and brain function and liver function, and whether or not you are putting yourself at risk for esophageal cancer or breast cancer or whatever by even what we might have considered subtle or not so intense uses of alcohol.
Yeah. One thing that got me interested in the changing patterns of alcohol use and consequences in American society and culture was this particular figure that diagnosis of cirrhosis, really significant liver disease and scarring, seems to be happening at younger and younger ages, and that trend is increasing faster in women than in men. Why might that be?
Women are drinking more than they used to, and women are more vulnerable to that consequence than men. The metabolism of alcohol in the body, alcohol dehydrogenase breaks the alcohol down a little bit, then aldehyde dehydrogenase breaks it down more, so it comes out carbon dioxide and water. That first enzyme, alcohol dehydrogenase, is present in the lining of the stomach and in liver. Men have more of it than women. So for a given dose of alcohol, the livers of women have to do more work to get rid of it. And when the liver is metabolizing alcohol, there are other things it can't do, like process fat. If you think of biochemical gears, they turn in one way to get rid of the alcohol, but they have to turn another way if they're going to get rid of fat. And with as little as 4 drinks a day for 4 days, liver biopsies before and after, there were fatty changes in the liver of people who drank that much. And this kind of gets at your question of amount and sequence. So binge drinking can have an effect on the liver. It is a reversible effect. So if you don't, I'll mix metaphors here, chain smoke your binges, the liver might recover in between. Yet, if you're in a binge and drive an automobile, you have other things to worry about.
Right. I really strongly suspect that people haven't got the true story about the risk associated with this, because I'm just learning it now, and I've been trying to study it. Right? There are a lot of people maybe not as interested in hearing it, and or heard what they heard in health class and whatever public messaging we have, and that's about the extent of it. Maybe they have 4 drinks on Friday, 4 drinks on Saturday, and 2 drinks on Sunday. And then they feel fine. They don't have cravings. They don't drink for the rest of the week. Maybe their partner is doing that in the same way, or their roommate, something like that.
Probably 30 or 40 years ago, someone said, addiction to alcohol is a disease of ignorance. Well, absent getting to the deep end of the pool and having the issues of control that would lead to a diagnosis of a serious use disorder, there are people, I would agree, there are people who are using, not thinking about it very much, and may have their lives cut short because of an esophageal cancer, for example. Right. And if it's, especially if it's not beer, if it's spirits, and if it's spirits, it's a more brown-colored spirit than vodka or gin. The risk of esophageal cancer goes up. It's more of a minefield than people give it credit for, even at sort of more modest levels of consumption.
Yeah, and that's what I'm sort of getting at. I think there's probably a lot of people that really think that they're really just fine. Maybe they have relatives or they know people that have significant problems, and they accurately see themselves as drinking in a very different pattern as those other people. But it may actually be having consequences.
Yeah. It probably is a different pattern. Yet it doesn't mean it's risk-free. What you don't know can hurt you.
An interesting thing to me, you mentioned the Canadian recommendations. I'd like to get into those a little bit in a minute, but in the lead up to developing those, I did some reading about how they got into that, and then what they did with it after they even had the recommendations. And they did some research that said, hey, if you had accurate information about things, even if you didn't like it, would you be likely to change? And it seemed to me that a lot of people, even teenagers, said, yeah, actually, probably I would. I'd think twice about what I'm doing, which I thought was really pretty interesting. And so I'm always sort of, I'm a hopeful rationalist even now, that like if we have information, that we might be able to use it in a different way to alter our behavior. I mean, fundamentally, that's a part of what underpins the whole idea of brief interventions, isn't it?
Yes, and I like the way you said it. You personalized it. If we, sort of first person, had more information, we might use it accordingly. And that's, again, the point of individual autonomy and individual responsibility. And I think it's very important that the people who develop these guidelines not try to impose it, yet be generous about sharing it.
Good. So what do they recommend up in Canada?
My reading is, you, dear individual, are the boss. You might want to pay attention to the continuum of risk associated with the consumption of alcohol. And if you really, really want to be on the safe side, 0 drinks is an attractive number. 1 or 2, sort of not so bad. But
1 or 2 in a week.
Hey, thank you for the clarification. Yeah. Whereas in the United States, it's been 1 or 2 a day.
Yeah.
Whereas the threshold is a much lower one.
And it seemed to me that they found that these lower numbers for low risk categories, that that once you're sort of outside of that, the chances of certain diseases, and they're fairly specific about it, your chance of breast and colon cancer, for example, increases even at the 3 to 6 drinks per week level. Mm-hmm. I mean, that's a finding totally absent from the American recommendations, for instance. And they noted that outside of that low risk category, your risks for, if you're a woman, go up more steeply than they do for men, I think, for the reasons you've described. And of course, the very heavy drinkers have really pretty significant risks of problems in all the areas. So there's a kind of a differentiation across, quantity in that way.
And there are individuals at the heavy consumption end of the spectrum who aren't planning to change anytime soon. Some individuals will come into treatment and describe themselves, well, I was a functioning alcoholic. And they'll say it with a certain amount of embarrassment, and now they're, even if they hit a relatively high bottom, a less consequential wake-up call, they are happy to make some changes. And there are some people that will, I think, wear the functioning alcoholic label like a badge and say, well, I'm doing this and I'm thriving in my point of view, so I'm going to keep on doing this.
Yeah, someone told me a story once about someone who worked really hard to cut alcohol out of their lives, having noticed negative effects primarily on their mental health in this instance. May or may not have met criteria for a diagnosable condition, but they saw the pattern. They wanted to change it. It wasn't so easy to change, but they did do it. And they told me a story later on that they went to a family gathering, and the family said, "Oh no, have a drink." And finally they said, "No, I'm an alcoholic," And they said, "No, you're not. No, you're not. We're all alcoholics. We're all alcoholics." And she said to them, "You're not, or if you are, you should look at that, because I did, and it makes me not want to drink, actually, right?" And so, okay, So I do think there's sometimes a kind of a normalization of potentially dangerous things in our culture that is just sort of begging for a little bit of correction, I think.
Well, yeah, and anything that you and I might say that would feel people more empowered to do that for themselves. Autonomy means you're the boss of certain things anyway, and you get to live with the consequences of how you handle that.
I heard that in Canada they've got signs in bars and things like that sort of give some of this information and little pithy quotes and things like that. So all drinking increases the risk of cancer is a common message, for example.
And on containers too, I understand.
And on containers too, yeah.
And it might be worth commenting on what a standard drink is. There's a lot of misunderstanding about that. And it's a drink that delivers a sort of known amount of ethanol, alcohol, 1.5 ounces of spirits, 12 ounces of a standard beer, 4 or 5 ounces of table wine. And there are fortified wines like sherry and port that have more than that amount of alcohol, and I guess fortified beers that do that. When people accept a serving of wine, it's often more than that 4 or 5 ounces, with all the more potential for intoxication and the impairment that can go with that, or if it's a regular thing, the health risks that you're describing.
And to just clear up one myth about it, basically, alcohol is the culprit here, right? If you're comparing, for the most part, if you're comparing some amount of alcohol in some concentration, there is an equivalence that drinking roughly the same amount of alcohol in beer is just as risky as drinking the same amount of alcohol in spirits, for example.
Yes. When it comes to presumably risk of cancer, there are some subtleties in terms of the risk of certain cancers where one beverage might have more risk than the others. Yet when people say, "Oh, I just drink beer," and a lot of them, I'm just as concerned as if it were, if it's 18 beers, if it's a bottle of wine or a pint of liquor, I'm going to worry.
Yeah. Years ago, I worked with someone who said he was going to treatment for alcohol, and he said when he got there, they found he drank so much he was medically at risk and had to go to the medical hospital. And he said later, that really surprised me. And I said, why? And he said, well, I was just drinking beer. And I said, but you had 30 of them. He said, well, yeah, but it was, so I think there's a misunderstanding. And there's some talk as a public health measure of standardizing those quantities and publishing them on cans and bottles, essentially that like, hey, this can of high alcohol beer that's also 20 ounces actually has 3.1 drinks in it.
Yes.
For example.
Yeah. I have it's a 35 millimeter slide, which tells you how old it is, of two guys sitting at a table, and in front of each of them is a snifter that's bigger than a bushel basket, and they're full of beer, and one is saying, and they're saying, well, I just have one drink a day.
Yeah, that's right. I think one other thing that this Canada report points out that I like a lot is that the consequences from use of alcohol are not just individual. We've talked a lot about the individual consequences, but that's part of how the World Health Organization also, for example, gets to the idea that maybe this is the most dangerous drug, that it isn't, that the harms can occur to others, socially, to and to the whole community, actually. And that might happen for sure with folks that have a diagnosable problem with alcohol, but it may actually also happen with folks that are using at a much lower level, for example.
Sure. Alcohol is well known to be disinhibiting, and self-disclose a little bit. I have a large family history of addiction to alcohol, and started drinking relatively late at age 19, but liked it too much, and had this sort of a family history positive people as I am, there's sort of an inborn tolerance. So I was, after a certain number of drinks, I was better able to drive than my mates because I had that bit of protection. But as far as the disinhibiting effects, I think back to a sort of a high school reunion when I was circulating around and talking to people, and I was rude. Not my style, I hope, but I was rude. And fast forward several years, I controlled my use of alcohol. People in AA and recovery say, well, if you control it, that means you got a problem, dude. But I controlled it. But I had 2 drinks one night, and I woke up with a headache. And that was the day the family was going to be taking down a tree, and it interfered with time with my kids and what have you. And that's the last time I had beverage alcohol. That was 1989. So I went from some, occasionally more than was a good idea, to 0. And I guess I can testify that 0 drinks per week is not a bad number. From my point of view, if I wandered into the diagnostic criteria, it was not very far. Yet there was enough in the way of consequences so that what was suitable for me and is kind of comfortable for me is 0. So I had to distance myself from what I thought was cool or what was sort of sociable or whatever to be more grounded in what makes sense for me.
And it was more of a social consequence that you noticed, a sort of a difference that you were not yourself.
Yeah, well, yeah, in the rude sense, but in a functional sense, I couldn't do what I wanted to do in my life that morning, and alcohol didn't compete with having a life.
I think we need to point out that there's also a very significant link between intimate partner violence and alcohol use, for example. So this relationship can show up in some very dark ways that maybe alcohol isn't the only root cause of that problem, but it is a cause that definitely seems to make that much more worse and much more dangerous.
Yeah, unwanted consequences. Also venereal disease and unwanted pregnancies and other things in that spectrum of intimate consequences.
Are the things that you've learned about alcohol in the 50 years of working with it and thinking about it that have really, maybe have really surprised you and stayed with you?
The surprise for me, I guess, is becoming more connected with what's actually going on. And that's the whole tenure of this conversation, that it's not just people who are sort of over the threshold and in the deep end of the pool. I mean, that's there, that still exists, and it's important to help those people. Yet the people who have not had a lot of attention, and we who see ourselves in this field have not been giving a lot of attention, is what the group you've been emphasizing from the beginning. It's everybody else who's sort of out in the community, have access to alcohol or cigarettes and cannabis and a lot of other things that have a certain exposure to risks, unless somebody really wants to go the careful route as far as alcohol is concerned and embrace 0 drinks a week.
Yeah.
And that's, to me, a socially acceptable thing. And if they don't embrace that, their call, they're the boss. And there are also consequences it's worth kind of knowing about and paying attention to.
And if someone wanted to read something or speak with somebody about their own use or the use of a loved one, wanted some more accurate information about this, where might they go to find that?
My first thought, and it may be a bit of a wisecrack, but into their own perceptions and their own consciousness. And to think not in terms of categories. We've had too much of that. But more descriptions. What is my behavior with respect to this? And what other people say about it, who know me well or are around me? Are there ways that I bump into myself or consequences? And I greatly favor description over labels. And I think of someone who said, I have an unhealthy relationship with alcohol. I don't drink every day, but when I do drink, I consume an inappropriate amount. And that person could fit somewhere in our diagnostic criteria, yet what that person needed was people to hear the problem and support the solution, which was getting away from the use of beverage alcohol.
And I think I I also would really recommend these to people take a look at this report that Canada put out about the guidelines that they have, because I actually think they did a really good job of summarizing a tremendous amount of medical research, mental health research, in a really pretty nice way. The overall recommendations are nice, but also the report underneath it is very nice.
And I strongly agree with that. And I think they do it with a unerring respect for the individual who might be looking at it. And they're not telling people what to do. They're offering them what they might want to think about as they decide what they're going to do.
Very good. Well, thank you, Dr. Kane. It has been a pleasure speaking with you today about all of this.
Stimulating and enjoyable to be here.
Thank you again to Dr. Kane for that very informative and stimulating conversation. Joining us again here is Mary Wilson.
Yeah, I found the conversation really fascinating. It struck me that Dr. Geoff Kane was really an advocate for personal autonomy, saying people need to have the freedom to make whatever health choices are right for them. And Kurt, you were really focused on the health risks, which seem to be quite dire.
Yeah, and I think I'd like to hope that there's a union of the two things. I mean, I do find it really interesting, actually, that in 50 years of practice, the place where Dr. Kane lands most solidly is in the realm of personal responsibility and decision-making, respect for the individual. And I think that should be a guiding light for all of us in the field. I mean, I think that is the way to approach all sorts of contentious and complicated problems, is really to try to understand that. And I sort of feel moved talking with him about that. But also not free of my worry about that I just have this sense of there's a thing going on here. And my hope was that maybe if we could have some more information about it, it might actually make it easier for people to think about the choices that they make, both individually and collectively.
And make an informed decision, because people may be choosing to drink and not realizing that the 3 or 4 drinks that they may see as just casual social drinking really could have some consequences.
Yeah, that's right. I think our sort of looking at alcohol problems as a sort of through the lens of alcoholism, or only at the extremes, has some real downsides to it. I mean, those are things that happen to some people, but I think there's a different story to tell here about really things that are not necessarily problem drinking, but that are causing problems for people who are drinking. And I think my hope would be that with different kinds of information, on a given day, maybe we might think about that a little better, take some of those guidelines to heart, that it is safer to drink less no matter how much or little you're drinking. Yeah. I find that a remarkable piece of information.
Me too. I think it will lead me to re-examine certain habits, and I hope that other listeners will as well.
And next week, we're going to continue this conversation, aren't we, through a slightly different lens.
That's right. We'll be hearing from Jeanette Hu, a psychotherapist and a sober curiosity guide. So we'll learn what it means to be sober curious, and this might be especially interesting for those who are participating in Dry January. But we'll dive into really all the societal and cultural norms around drinking, why we do it, why it's so closely connected to celebrations and relaxation. So that should be a really interesting episode.
Oh, I can't wait. That sounds really great. Unravelling is brought to you by Brattleboro Retreat and is produced by Charts and Leisure.
Find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.